Welcome to Wisconsin Women. We're filming on the Monona waterfront today, and we're looking out for your wealth, as we'll be chatting with RMR Wealth Advisors a little bit later in the program. Right now, though, we are looking out for your health, and joining us right now is Dr. Ashley Woyak. She's the owner of Forward Natural Medicine. Thanks for joining us.
Yes, thank you for having me.
Now, Dr. Ashley, you're a naturopathic and chiropractic doctor, and you also have training in neurology and functional medicine.
Yeah.
That's really amazing breadth of knowledge and experience. So I'm curious, what are patients coming to you for? What kind of symptoms?
The main thing I see in my office right now is a lot of fatigue, a lot of women who are just exhausted, can't get through the day, or just brain fog, like they're just not there. Or anxiety, depression, that's a big one, or the inability to lose weight. Everyone's like dieting or not eating and then going to the gym all the time. Hair loss, that kind of stuff. That's the most common right now I'm seeing in my office.
I feel like she just described all of us.
Yes.
Right, definitely fatigue here.
Yeah.
I didn't want to sleep with a little baby.
Yeah.
So when a patient comes, what does the actual care look like?
Yeah, so when I see a patient, I typically do a pretty extensive exam and an intake. So I do a lot of paperwork figuring out like their history, getting a good grasp on that, all their symptoms, their concerns, family history, diet, lifestyle. And I think a lot of patients appreciate that because they go to their traditional medical doctor, and a lot of times they're just kind of a number, like, oh, you're fine, your numbers are fine, I don't know why you're fatigued, you're getting old, like that's it. And they don't feel listened to. I mean, there are some patients have great doctors out there, but that's kind of generally what I'm hearing from my patients, And so they're just really happy when someone's finally listening and whatnot. And then I know I've mentioned before, I do a pretty comprehensive lab work for all my patients because, if you've got a vitamin D deficiency or anemia or a thyroid problem or, inflammation, like it doesn't matter what supplement or diet you try, we've got to get that figured out to kind of get your underlying issues.
That comprehensive care is really something you take pride in, too.
Yeah. So I know that you do a lot of work with the thyroid, and I think a question that probably a lot of our viewers have is, what is the difference between just low thyroid problems and Hashimoto's disease, which sounds kind of serious and scary?
Yeah, I know, right?
Yeah.
Like,
Yeah, it is.
what? And that's the thing, because the symptoms are really similar for all low thyroid patients or Hashimoto's, the weight gain, fatigue, hair loss, all that stuff. The difference is low thyroid is like your thyroid's just not working properly, and we do have to figure out why that's going on because there's a variety of issues there. But Hashimoto's, which is the #1 cause for low thyroid, is when your immune system is attacking your thyroid for some reason. So at the end of the day, it's actually not even a thyroid problem at all. It's an immune system problem. And so we've got to figure out like why that's happening. And a lot of doctors, I feel bad for patients because they'll have these symptoms for years and years and years, and doctors never run the antibody testing for it. And so they don't even know that that's actually why they have the low thyroid. So, and then finally we can figure that out and then kind of go on. It's like peeling layers of an onion off, figure out what's going on with that patient. So,
what are the common, triggers?
Yeah, and this is for not only Hashimoto's, but any autoimmune disease, because there's so many out there. Hashimoto's is just so known because it's so common in women, but common triggers can be stress, that's a big one, so getting that under control. It can be hormones, so a lot of times I see women after giving birth to a baby, that's when their Hashimoto's will flare up or begin their symptoms. It can be environmental toxins, so that could be like mold in their home or at work, plastics. It could be chronic underlying infections, so some people have had mono or Lyme in the past, and that can be an issue. Those are kind of the big ones. Yeah, those are the most common ones.
And you kind of have to be a detective to help
definitely
get into the story.
It's not
of this.
easy, it's. I wish it were super easy, like, oh, here you go, here's the pill, the magic answer, but
I don't buy that. I think you like the puzzle.
I do. I love it. I love looking, going in depth for all my patients, and I love when they are excited that there's an answer. Like, oh my gosh, finally someone to tell me what's wrong with me. You know what I mean? I feel bad. I'm like, yeah, here's your problems. That's so exciting. Now we can actually work on them.
Sure.
Right.
So then do you actually have patients that can be off medications down the road?
Yeah, and that's something we work, both I with their doctor and them with their doctor. Legally I would never tell them go off this medication, anything like that. But a lot of times they keep feeling better and better, so they'll go to their doctor and eventually get off one of their medications, or we'll slowly decrease them. Whether it's thyroid or an anxiety med, something like that.
Dr. Ashley Woyak, well, thank you so much for joining us today.
Thank you.
Always interesting information. If you have your own questions, you can check her out online or go visit her on John Nolan Drive. We'll be right back with more Wisconsin Women.